Hey guys, we're live. Facebook Friday. Here to answer your questions. Things are just starting up, so if you're jumping on the stream, let me know if you can see it and hear it. And then while we're waiting on everybody to jump on, just a couple things to tell you about birth control pills. So there's a new statement that came out in the United Kingdom that talks about some of the benefits of birth control pills and just some maybe the finer points to know. And so I thought, hey, what the heck? Let's go through a couple of those while people were jumping on the stream. Let me know on YouTube. Also, thanks there, Love Vita, if the stream quality is okay. I've sort of changed some of the settings, so I'm trying to figure out if it's working okay or not. So let me know. But so yeah, as we're getting going here, there's a few points to give you on birth control pills. Certainly, there's a detailed video on my YouTube channel that talks about the contraceptive options, one of which, of course, is birth control pills. There's a whole video going through all the different options, so if you're curious, you can check that out. But just for a minute to talk about birth control pills specifically. Hey, Laren. Hey, Shauna, people are jumping on. Good. Thanks for the info that you're picking me up. Let me know on Facebook if it's working too. I see some eyeballs jumping on, but I can't tell if it's working or not. So let me know on Facebook if you're hearing me okay. So yeah, a few things to tell you about birth control pills. One of the big ones, and I think a lot of people already know this, this is not new information, but people may forget that, let's see. Okay, thanks. Londi said, oh, hang on, it just rotated strangely. I don't know what's going on there. Is my head sideways? I don't know what's happened. That's kind of crazy. Whoa. Rotate your phone. Sorry on Facebook. Is my face sideways in the camera? I can't tell. It looks like it might be. Let me know. Sorry. I don't know what has happened. It's very strange. You are not sideways. Thank you. I appreciate that. I'm not sure why it looks sideways to me, but it does. That's really weird. Maybe it's like taking up your whole phone screen. I'm still trying to figure out this streaming thing. Let me see if I can get my face kind of centered. There we go. All right, cool. So if you have questions, thanks, Penny, for letting me know it's working. My face is not sideways. It looks really weird to me because it's sideways. But if it looks okay to you guys, we'll just roll with it. And on YouTube, I'm upright. Thank you. All right, so I think all systems are working. So if you have questions, stick them in the chat. And then for a minute, we're just going to talk about some of the birth control stuff. So one thing I think everybody knows, but it's worth reminding you, you can skip the placebo pills and a birth control pill. You do not have to have a period every month. I read an article a couple days ago talking about where the theories were on how the period or the placebo pills came to be. And I don't know if it's true or not. There was one theory or one statement that was out there supposedly from one of the initial developers of birth control pills that they put those in there to please the Pope. Now, I don't know if that's true or not, but the idea was that if it mimicked a natural cycle, maybe the Pope would be okay with that because, of course, the Pope was not very big on birth control. I don't think that that's a big surprise. So interesting that maybe that's the truth. I've also heard other stories that it was kind of a paternalistic thing where, oh, if you don't have your period, people think it's weird and therefore they won't take them. And maybe that's why it's in there. And I don't know that anybody really knows. But the bottom line is you don't have to take those placebo pills. You don't have to have a period. So if you have bad periods, if you have painful periods, or if you just don't want your period, you don't have to take them. And one interesting thing I was just reading the other day is that it is possible that the pregnancy rate is a little higher if you take those full 7 days of placebo pills. Makes sense. Because during those 7 days, you might have an opportunity to ovulate, and that, of course, could lead to getting pregnant. So it may be that the contraceptive effect is a little better in people who take them continuously. So there's a little fine point you might not know. So beyond the benefit of skipping cycles is it might be that it's more effective if you don't take those placebo pills. Hey, Kayla, just jumped on. How's it going? So if you have questions, stick them in the chat, you guys. Going to keep talking about birth control pills. Looks like Katie made it. Hello, Katie. Katie's checking in from Boston. Awesome. Welcome. Let's see. let me go back to this other thing. Here we go. Sorry, I've got like 5 screens open to do this stream. It's crazy. There we go. So if anybody has a question on YouTube, stick it in the question. Flozy Hope or Flozzy Hope says she has a question about Clomid. Hit me if you have a question. I'm ready. But while I'm waiting on questions, we're going to throw you some more information on birth control pills. There has been some question if you are over a certain weight or over a certain body mass index, if birth control pills may or may not be as effective. And the debate is still kind of back and forth on that. I think that if there is a reduced effect, it's slight, but it may be that there is a slight reduction in effectiveness for people over who are extremely overweight, so over 90 kilograms. There's a statement here from this information that I'm reading that says limited evidence suggests a possible reduction in patch effectiveness. And that's not birth control pills, but the birth control patch. When they talk about birth control pills, they say most evidence suggests no association between body mass index and effectiveness. So it's more about the patch. They do mention that bariatric surgery, so weight loss surgery, might reduce effectiveness, and that may have more to do with absorption of the medication than it does any particular weight. So if you've had, gastric bypass surgery or something like that, it might mess with the effectiveness of birth control pills. So that's good to know. A few other things people may or may not know. There's certain medications that can either affect the birth control or contraceptive effect, or it may interact and cause problems with your other medications. So some of these anti-seizure meds may be a problem. So, okay, let's see. Sydney, I'm trying to turn my head sideways so I can read. Choosing to be induced, and if labor is going to be for a long time, what is the point you would need, got to click see more, to do a C-section. Okay, so it's a good question. And the bottom line is that my head is like turned sideways and frozen on YouTube. That's so weird. There's no set period of time beyond which you have to say, well, now you need a C-section because you've been in labor for X number of hours. So it's not about that at all. And there's two kind of big concepts when it comes to how long this face, it's like it's totally distracting me because on YouTube it keeps freezing. Let me know, guys, if it's freezing on the stream on YouTube. It looks like it's freezing to me. So I'm going to try to change the settings real quick before we get too far into this and just see if I can make it not be so jumpy. So bear with me just a second. Just going to change my stream settings a little bit. Output, bit rate. Let's bring that bit rate down a little bit. Let's go down to 3000 on the bit rate. See if that helps. Apply. Okay, hopefully you'll find it's less jumpy now on YouTube. Pretty choppy. Let me know, Kimberly, if it's getting better. I just changed the settings there, so hopefully that gets better. It just has to do with my upload speed. Picture's freezing, but the audio isn't. Thanks, Keely. Let me know. Give it a minute and let's see what happens because I just changed the settings. Hopefully it gets better. Okay, so while we're going, let's see. Been trying to conceive for many years. Got pregnant in 17, but empty sac. So what we call an anembryonic gestation. Since then, been trying again, but no success. Clomid, but afraid to take. I wouldn't be afraid to take Clomid. Clomid's safe. There's really no evidence of any kind of long-term health risks. You got about a 5% risk of twins, and that's about it. So no major big deal. And then let's see, Keely says it's safe to take lansoprazole during pregnancy. Yes. So any of the acid suppressing medicines, so omeprazole, lansoprazole, Prevacid, Prilosec, Zantac, Tagamet, Tums, they're all fine. And they all work in different mechanisms. So if you found one that works for you with lansoprazole, that's fine. So no problem. Kimberly says seems better. Good, thank you. Let me know, guys, on YouTube how it's going. It seems like it's working better, a little bit less choppy, maybe, hopefully. Okay, let's see. I saw a question popping up over here on Facebook. Let's see. On the mini pill, started to wean, 13-month-old, faithful about taking it. Do you need to get another pill? I always recommend if you stop nursing to switch from the mini pill, and the reason is that it is a little bit less effective. So you miss one pill and the next thing you know, you're pregnant with a mini pill. So I always tell people when you stop nursing, switch to a real pill. That's always my advice. Talking back and forth here with Flozy, he's just saying afraid of not getting pregnant, afraid of lost hope. Well, I'm sorry to hear that, but don't give up. There's plenty of evidence that Clomid helps, and I wish you the best. Good luck. Let's see, Laren, it says, if I end up getting a C-section when your tube's tied, is recovery much different? No. So the recovery is no different whether you have a tubal or not at the time of a C-section. And it's certainly a pretty convenient time to do a tubal. I mean, you're already there, and you're already open, so it really doesn't change a thing. So if you're planning on sterilization and you have a C-section, it's a good one. All right, let's see. Blondie, I think, can birth control make your eyes go blurry? I don't think so. I don't think that's a birth control thing. I'd maybe get your eyes checked, though. Sorry, I'm trying to make sure I'm in this picture. There we go. Been on the IUD for 3 months and now haven't stopped spotting. When does it ever stop? Yeah, it's pretty common. It usually goes away. I always tell people, you know, whatever you get at 6 months is probably what you're going to have going forward. So give it a few more months. You're only 3 months in. Odds are it will continue to improve. So hang in there with that. And you figure by about 6 months, whatever it is at that point, it's what it's going to be. Okay, so let's see. Janet, about 3 days after period ends, pains on the right side and goes down your thigh. So I got to turn my head sideways because for some reason my comments were sideways. Ever since last baby was born, never had this pain before he was born. I have an IUD. It might be related to the IUD. So there definitely are people who have pain associated with their IUDs. I just had one very recently where a patient was complaining of sort of menstrual type crampy pain, and did an ultrasound, did an exam, things were normal, and the only thing was she did have an IUD, and she decided to take it out, so I did. And while taking it out, she had the exact pain. She's like, that's the pain. So I do think that it can cause pain even when it's normally positioned and there's no apparent problems. So I don't think that it's dangerous, but if it's bothering you, then it's certainly reasonable to think about taking it out and doing something else for birth control. Let's see, Becca says, why is progesterone given until 10 weeks with IVF? Yeah. So the idea is that we do give progesterone to patients who have conceived with in vitro during the first 10 weeks because there's no corpus luteum that forms because you don't actually ovulate when you go through IVF. And so this is kind of a fine point. If you're not into IVF, probably don't really care about this, but Becca's interested, so I'll just answer it for a second. So the idea is that your eggs are stimulated, your ovaries are stimulated, the eggs are removed from the ovaries with a little transvaginal procedure, and those eggs are then fertilized in the lab, and then those embryos are put back in the uterus. But during that whole process, you'll notice that I didn't say, and then you ovulated at some point. You never ovulated. When you are talking about a spontaneous cycle and you ovulate, you will produce progesterone because you make a corpus luteum. And the corpus luteum is the little area in the ovary where the follicle released the egg. And that functions till about 10 weeks when the placenta takes over. So if you didn't ovulate, you don't have a corpus luteum. If you don't have a corpus luteum, you don't have progesterone. If you don't have progesterone, then pregnancy won't survive. And so that's why they give you supplemental progesterone in an IVF cycle. That's really the only situation that I know of where supplemental progesterone actually improves pregnancy outcomes. So that's why. But we don't, people often try to use it for pregnancy support, say for history of miscarriage, and unfortunately the evidence is just not there that it's effective. So people use it. I'm okay if they use it, but it's just not proven to be effective, with the exception of in vitro. All right, Genesis. Let's see. What are some tips for women starting IVF after continued miscarriage? Basically, you just have to do the things that they tell you to do before your IVF cycle. There's nothing specific that I'm aware of. They typically put patients on a birth control pill to regulate their cycle, prevent spontaneous ovulation, keep your endometrium suppressed so they kind of know where you are in the cycle. But the idea of using in vitro for recurrent miscarriage is pretty common. And the idea is that if you have basically unexplained recurrent miscarriages, so all the usual suspects have been ruled out, and it seems like things are normal, but you just keep having miscarriages, then doing in vitro can be helpful because there may be an issue with egg quality or embryo quality. And that is usually pretty easy to figure out during in vitro. So they can You can look at the embryos in the lab under the microscope, and they can pretty much say, this one looks good, let's use that one. This one doesn't look good, don't use that. Don't use this other one. So that's the idea of in vitro for recurrent miscarriage. But beyond that, not a whole lot of specific advice that has to do with that question. All right, so yeah, Flozy, if you have a question, just stick it in the chat. I'll be happy to answer it for you. Let's see what we've got here on Facebook. 11 months postpartum from twins last month. Have very painful cramps, about 3 weeks. I got to turn my head sideways. And increased hair growth on the chin. I've had the Nexplanon since 8 weeks postpartum. Had it before pregnancy, but never these issues. Any idea? Yeah, it could be related to the Nexplanon. You know, anytime you introduce a new hormonal birth control and you start having hormonal side effects, it could be related to that. I'm going to open up a new window here. Hang on just a second. So I can maybe see my Facebook comments without having to turn my head sideways. So just bear with me a second, everybody. I've got like so many screens going. Let's do this. Let's go see if I can find my live stream on Circle of Life. There it is. Now, the only catch is, will the comments show up in the chat? Let's hope they do. Let's see. Click for more. All right, let's see if this is going to work. All right, cool. Looks like I'm getting the comments on Facebook here. So, here we go. Yeah, so Morgan, as far as the side effects you were talking about, I would be inclined to say until you get the get the Nexplanon out, you might have these problems. It's hard to know, but progesterone, it's a progesterone only method, and progesterone is kind of like testosterone, and so you may see more acne, you may see more facial hair, maybe as a pure progesterone type of birth control. So, you know, one idea before you pull the plug on the Nexplanon is to take a birth control pill on top of it for like a month or two and see if that seems to help. If it does, then I'd blame the Nexplanon, and then, you know, if you want to take it out, then take it out, but you've got other birth control at that point. Or maybe consider switching over to an IUD because it's a lower dose of progesterone. All right, Haley. Also don't have a normal period every month. Changing, is that it's never consistent? Yeah, like I was saying before, within the first 6 months with an IUD, it's fairly common to have irregular periods. So if it's within the first 6 months, just kind of wait and see what happens. But at 6 months, pretty much whatever you're having is what you can pretty much count on going forward. Okay, let's see. What do you think about maca root? I don't know anything about it. The problem with these supplements is, at least in the US, this is not necessarily true in Europe, but in the US, supplements are not regulated. They're not well tested. We often don't know what the heck we're giving people when they choose to take a supplement. So, for example, something like the maca root, we have no idea in the US. There's just not good data. So, unfortunately, I just don't have a good answer for you. Sorry. Mary says, is it okay to take Zoloft if you're trying to conceive? Yeah, it's fine. So there's actually a video on my YouTube channel, which you're watching right now. So when you're done watching this, if you jump over to my videos, there's one that's called SSRI risks in pregnancy or something like that. And Zoloft, of course, is an SSRI. So I go through it in a lot of detail in that video, but the gist of it is there's no evidence of, no significant evidence of increased risk of birth defects. So, you know, not something that I would worry about personally, but I go through it more in detail. So check out the video. All right. Let's see. Crystal said, can birth control help with hormonal imbalances in premenopausal women? Yes. Do you test to see which levels are? Not really, because it's pretty hard to interpret most of the time, I think. Severe symptoms week before and up to 3 days after period. Yeah. So there's good evidence that birth control pills help with these kind of premenstrual and menstrual related symptoms. You don't really need to check hormone levels to know that, and like I was saying, I don't really check them because they're kind of hard to interpret, and so I would just try it. If it works, great. Let's see, Sarah, how common are failed epidurals during labor? Fairly uncommon. Fairly uncommon. First epidural worked for about an hour. It's not very likely, with the exception of if you have some kind of weird, you know, spine anatomy. So if you've had a lumbar fusion or you have rods for scoliosis or something like that. But if you don't, pretty uncommon. It may have just been bad luck. Kristen, hey Kristen, 8 weeks post-op hysterectomy, random lower abdominal pain right side. you keep an eye on it and see. If it gets severe, definitely come see me. It may just be sort of healing and things settling in after surgery. The kind of things that I think about after major surgery, like a hysterectomy, would be, are you having a fever? Are you having heavy vaginal bleeding? Are you having any problems with urination or your bowel movements? And if any of those things seem to be a problem, then it ought to get checked out. But if all those things are fine and just having some kind of random pain, it's probably just healing process and not anything to really worry about. So let me know. Keep an eye on it. Let's see. Kimberly, do epidurals really cause lasting effects? No. There's no evidence of any long-term health consequences of an epidural. It's very common for people after childbirth to say, I've got this low back pain. It's in the spot where my epidural was. They think that the epidural caused it. You may get some temporary low back pain that resolves, but I'm not aware of any evidence that says there's any long-lasting effect beyond that. So if I was having a baby, I'd have an epidural every time. I wouldn't think twice about it. All right, Kristen, I'm glad nothing else. So let me know if anything else is going on. Catherine, should you take off your C-section steri strips over the incision? I take them off seven days post-op. So if you're a week out, you can take them off. It's fine. I've seen people come back 6 weeks and they're still stuck on there. So they can be pretty sticky. So I just take them off if it's been a week. Let's see. Keely, what makes you decide to go with the C-section during labor if natural birth was the goal initially? That's a great question. So it's a long answer. So everybody settle in. It's worth talking about. So I'll try to sort of summarize it, but it's not a quick answer. Basically, you can break it up into two categories more or less. So maternal indications and fetal indications. In other words, there might be reasons you need to do it for mom, and there might be reasons you need to do it for baby. And some of them are kind of overlapping with each other, but the easy one to talk about is for baby. So, if there is a heart rate tracing that is significantly concerning, and that's vague, and I can't talk about that whole thing because that would take forever. But there are situations where fetal heart rate tracing is concerning enough that if a mom is not either progressing quickly or approaching delivery soon, a C-section might be indicated for baby's benefit. So we know that labor can be a stressful event. There are times when during labor, baby might not be getting enough oxygen. That can cause long-term problems for a baby. And you kind of have to be able to just interpret the fetal heart rate tracing, which is not always easy, but that's the best tool we have, and so we use it. So if they, hey, Island Girl's back from Italy. Good to see you again. Back, she's just all the way from Italy, folks. But anyway, fetal indications mostly have to do with fetal heart rate tracings that are, concerning enough that you need to get the baby out. Maternal indications are mostly about labor that's not going as well as, you would like it to be. And the big picture answer there is that, you have to be patient. That is the big thing. I just lost my other thing. Hang on a second. Being patient is the key to that whole deal. Sorry, I got too many windows open. There we go. And there's a whole article about this that's like 30 pages long that talks about how to try to avoid the first C-section. And I can just assure you that personally, that's how I practice medicine. I follow that guideline as best I can to an absolute, to the letter. And it mostly has to do with being patient, giving enough time for labor to progress. And that is probably one of the #1 culprits for why C-sections happen, outside of concern for the fetal heart rate tracing, which again can be tricky. But the gist of it is, in early labor, you need to give way more time. And somebody was asking about that a little while ago, like, well, why would you do a C-section? And in early labor, so in the latent phase of labor, basically there's no time limit as far as I'm concerned, as long as mom and baby are doing okay. Once you get into active labor, you're beyond 6 centimeters or now, or beyond, then you're a little bit on the clock, but it's not a set in stone kind of thing. So if you have no cervical change for something like 4 to 6 hours when you're at least 6 centimeters, then you start thinking about C-section might be indicated, and it may just be that the baby doesn't fit at that point. Okay, let's see. There was a question up there I missed that Kimberly, thanks, is answering for me. And the question was, what causes an empty sac pregnancy? So we call that a blighted ovum. That's the kind of the old term, or anembryonic gestation, which Kimberly so correctly wrote. And it's exactly what she said it was. And so there's no visible embryo that developed. So there's just a little gestational sac and nothing else. And chromosomal abnormalities are a fairly common reason why that happens. So you're exactly right. So if I don't get your question quick enough, just ask Kimberly, because she knows. Let's see. She Googled it. Good job. Kate. Hey, Kate. Husband and I have been trying for baby number 3 for a few months. No luck. When should we seek help? I mean, sort of the technical answer is a year of trying, no success. Doesn't mean you have to wait that long. The kind of things that I would just think about real quick, sperm, ovulation, and tubes. So, you know, previously, if it's the same husband, obviously, sperm are probably okay, and the tubes are probably okay, unless something changed in either one of your health history. So it does raise the question about ovulation. And so the first question I always think of was, are your periods regular? Are you seeing evidence for ovulation? If they're not regular, or if you're not seeing positive ovulation kits, or no other signs of ovulation, then that might be an issue that can develop really at any time. So that might be what's going on. So if you're going 7 months, it's not wrong to give another couple months or so. Maybe think about making an appointment, come in and get checked out, kind of go through all those things. There is a video on my YouTube channel that talks about evaluation of infertility, and it's really the same evaluation whether it's primary infertility, in other words, never had a kid, or secondary infertility, where you have had babies before but now you can't. So you can look at that video to get a little bit more detailed discussion of the evaluation of infertility. Kate, you may know, you may not know. So I'll put it in here. So my YouTube channel is the quick way to get there, Wes D Ski. If you just pop that into YouTube search, you'll find the channel. And there's a whole playlist on there about infertility that you can check out. So check that out and let me know. If you have questions, you can put them in the comments of that video and I'll get back to you. Let's see. Island Girl, is it a must that you have ultrasounds while taking Clomid? No, it's not a must. Can you just take it and try it? Yeah, absolutely. And for the longest time, I think that's what most people did. I have moved more to using follicle checks, and I discussed that in my video on my YouTube channel. Talks about it's called How to Take Clomid or Femara, to monitor for follicular development so that we know that it's actually working. There are people who will take Clomid and not ovulate. So I can't tell if my wife was yelling at me. I can't tell. Maybe she's just talking to someone on the phone. Okay, so that's why I use ultrasound. Let's see, Fuzzy, is empty sac pregnancy same with an ectopic pregnancy? No, they're really different. So you won't see a gestational sac in the uterus if you have an ectopic pregnancy, unless you have a very rare condition called a heterotopic pregnancy, where you have a pregnancy in the uterus and a pregnancy in the tube. Supposedly that's like a 1 in 20,000 thing, so fairly uncommon. But you may see what's called a pseudosac. So you see a little collection of fluid in the uterine cavity, but it's not a true gestational sac. You can usually tell the difference on an ultrasound, not always, but there's some characteristics of a gestational sac that are usually fairly easy to identify, but not always. Let's see. Carla, how do you help someone who wants to regulate their hormones to conceive naturally? 22, got some irregular cycles, hot flashes, recently had decreased libido. Let's see if that's the whole, I think that's the whole comment. Yep. Used to be regular, no problems, got them more when I was 18. Yeah. You know, one of the most common, if you have infrequent periods, is probably just not ovulating regularly, and there are kind of a series of medical things that we look at to test for, say, hypothyroidism, test for a thing called a prolactinoma with a prolactin level, which is a benign brain tumor that can cause infrequent periods. Once you've ruled those two things out, then you're probably just not ovulating regularly. And in terms of conceiving naturally, it's a little bit harder if that's the situation, because you're just not ovulating regularly. And if you don't ovulate regularly, then it's hard to get pregnant. The one kind of natural solution might be if you are diagnosed with PCOS, if you're overweight. There are studies that show that people who have PCOS and have some weight loss tend to have a little better pregnancy outcomes. In other words, getting pregnant easier. So that's one to consider is if you're overweight, trying to lose about 10 or 15% of your current body weight may lead to spontaneous ovulation. So that is natural. And if you're looking for natural ways, that's a thing. So something to consider there. Let's see, Nikki, how often do you see hormone-based stage 2 breast cancer after having a baby? I don't have a number, so sorry I can't quote that to you. I'm not an oncologist and not an expert on breast cancer by any stretch. But, you know, breast cancer can happen to somebody before or after childbearing. So I don't know that there's anything specific to childbirth that has to do with your question. Sorry, I don't have a better answer for you there. Thanks, Bethany. Yeah, I just got my hair cut. That's why I'm late today. I had to go get my hair cut. Let's see. Got a question over here on YouTube. Trying to conceive 1 year, no results. My P lasts 1 to 2. I'm assuming it's period. I'm assuming 1 to 2 days. Any problems with, please? I'm not sure that I fully understand your question, but there is a video on the YouTube channel that you're watching right now that talks about the evaluation of infertility. So I would go watch that, and it kind of talks you through all the different aspects of what I look at for somebody who's having a hard time getting pregnant, and it'll probably answer your question. Let's see, Flozy. I usually use an ovulation tracker. It shows 2 red lines, don't see any discharge. Yeah, so cervical mucus is a pretty reasonable way to follow for ovulation. And so I think that's what you're saying. But not everybody is able to tell a difference in their cervical mucus to really know. So ovulation kits, I think, can be helpful. Although the cervical mucus, as it turns out, if you're tracking it, if you're able to track it, is one of the best ways to predict ovulation, as it turns out. All right, let's see. Can low iron cause your AMH to be low? I think that's what you're asking. No. So iron stores don't have anything to do with ovarian reserve. I think it's a yes, no question. The answer is no. There is a video on my YouTube channel that talks about AMH testing that you might want to go watch. So it turns out that AMH is not a very good predictor of spontaneous pregnancies. In other words, if you're not doing IVF and you're trying to get pregnant, the AMH is not a good test, and so I don't do it anymore. And I discussed the research that I base that on in the video on my YouTube channel. Now, it's a different story if you're using it for IVF predictions, so that's a different thing entirely. But if we're talking about spontaneous cycles, AMH is not a good test. Kaylee, let's see. What is the top birth control besides Mirena? Oh, you know, there must be a dog walking by out there. Hang on a second. Hey, hush. We're doing a live stream. Top birth controls besides Mirena, I mean, probably the most common, if that's your question, is going to be birth control pills is the next most common thing. Sorry, they'll quit barking in a minute whenever whoever walks by. So I'm not sure if you have a specific question beyond that. There is a video on my YouTube channel that talks about all the different methods of birth control. So you can go check that out. And I talk about all the pros and cons of all the different methods. So maybe take a look at that, and that might answer your question. All right. I missed one earlier. Sorry, Sarah. Tested positive for group B strep, early pregnancy. Doctor said can be caused by vegetables that we eat. Have you heard anything about that? No, I've not. You know, group B strep is a bacteria. It is thought to be a vaginal and rectal colonizer, and we don't really know what makes it come and go, but it does come and go, but I don't think it's what you're eating. Sorry, I missed your thing earlier. Let's see. I'm looking through the phone here to make sure I didn't miss any, because I'm not sure they're all popping up on. Not sure they're all popping up on my computer screen. I think I'm caught up. All right. Let's see. Got something over here on YouTube. How long does the Ovulation trigger stay in your system? Probably about 2 weeks at the most. So it's one of those things that, excuse me, doesn't take long to get out of your system. It's cleared by your urine. You could get a false positive pregnancy test if you tested too soon after you had a trigger shot. So we use HCG, and in the U.S., Ovidrel is a name brand, but same concept, I think. Let's see, Nancy, 3 miscarriages, what needs to be done? Got your tubes checked for blockage, uterus for polyps. Yeah, so that's a big one. Another big one that's part of the evaluation for recurrent miscarriage is what's called the anti-phospholipid antibody panel. And you should definitely get that done. It's a blood test. It is essentially an autoimmune type disorder. It is associated with other bad things like blood clots and strokes and other adverse pregnancy outcomes. So it is not a good thing to test positive for, but it's treatable, which is the good news. Essentially, it becomes like a clotting disorder. So we put those people on blood thinners like Lovenox or heparin plus a low dose aspirin. So I would definitely check that. Now, if your HSG was normal, which you said it was, let's say you tested for the anti-phospholipid antibody stuff and it was all negative, well, then what? Chromosomal abnormalities are fairly common. It's something like 5% of the general population has what's called a balanced translocation. It's probably higher than that in folks who've had recurrent miscarriages. So getting that checked is probably a good idea at this point. There's a YouTube video that talks about evaluation of recurrent miscarriage on my channel. So you can go watch it, and I kind of explain what a balanced translocation is. I tried to use some straws to sort of demonstrate like what chromosomes look like. So the thumbnail is me holding like a straw. So it'd be easy to find. If you go to my infertility playlist, you can check that out and look at that in some detail. If those things all check out, then you're probably in that poor egg quality, poor embryo quality category. A lot of people at that time go to in vitro because pretty much everything else is checking out normal. Okay. I think I'm caught up. Let's see, Keely, when the mucus plug comes out, is that a sign labor's close? No. And does the mucus plug coming out happen with every woman? No. Both good questions. And it's a really good topic that we get questions about, phone calls about all the time. So thanks for asking it. Everyone should be made aware of the fact that if your mucus plug comes out, it doesn't mean a thing. It's more like the pregnant cervix is kind of like a runny nose. And so you may just make a lot of mucus when you're pregnant, and that's all that it really means. So basically ignore it. It's one of the things that the nurses at the hospital are always telling me, make a video about the mucus plug. Tell them it's not a thing. So so this is for you, labor and delivery. If anybody's watching on L&D, let me know. Sometimes the nurses get on there and watch these things. Let's see. Savannah, how often do you hear of vaginal birth controls get embedded in the uterine wall? I think you're talking about an IUD because it wouldn't be, you wouldn't have like a vaginal birth control as the NuvaRing, and there's no way that gets into the uterus. So I think you're talking about IUDs, and so the question is more like how often do you hear about IUDs? Mechanical complications of an IUD, they happen. They're not as big of a deal as some people may think they are. They definitely can get a little stuck into the uterus. They're usually fairly easy to remove either in the office or under a little bit of anesthesia. It's a thing. It's maybe a 5 to 10% of all IUDs kind of thing. So it's not a huge thing, but I definitely see it. My experience has been doesn't lead to any increased risk of infertility or anything like that. So nothing to worry about, but it can make an IUD removal more difficult. And sometimes leads to what we call a hysteroscopic removal. So we just take you to the operating room, put a little camera in there, and just pull the IUD out that way. So it's usually pretty easy to fix. Let's see. We've got some questions coming in on YouTube. Thanks, guys. Coming in hot. Let's see. Julia, took the first cycle of blame it on the 1st of January. I'm not sure. Maybe that was Clomid and your phone auto replaced it, which is awesome. So we took some blame it on the 1st of January, 50 milligrams, so I'm assuming that's Clomid, using OPKs, ovulated something like, what is that, 7, 18, 15 days later, 16 days later. Is this normal? Yeah, sounds about right. Sounds like pretty good first cycle of Clomid. Let's see, Londi was chiming in, first pregnancy, everyone's telling me about that mucus plug, you're right. And it is not the case. You're right. 3 times she's been proving it now. It's fun telling other mamas that it means nothing, and you know it's right. Okay, let's see. Lisa. Sinus infection. I had a sinus infection and did some blood tests. Okay, monocytes were a little high. White count was low. Can the sinus infection? Yeah, maybe. It may just be a response to your infection. I would maybe just repeat blood work when you're over that. It sounds like pretty non-specific stuff, at least based on what information you gave me. Sort of depends on how low your white blood cell count was. And it sort of depends on how high that monocyte count is. Without looking at the actual report, it's hard to know because they're reported in different ways in different labs and in different countries. But maybe just rechecking in a couple weeks to see what the results are. And if it went back to normal, it was probably just your sinus infection. Nancy said, diagnosed with PCOS. Does that cause miscarriages? No. Does it have anything to do with miscarriages? No. So PCOS primarily is associated with just a harder time getting pregnant because you don't ovulate regularly. But no increased risk of miscarriage. Yeah, Julie, I thought that was the autocorrect thing. Okay. I think I'm caught up, you guys. Let me know if I did not answer your question. I think I've seen all of them, but I had to like turn my head sideways for some of them, and then I think I got them working over here on my computer screen. Carla, should you go to a specialist test for thyroid issues for hormonal imbalance? Yeah, your regular GYN doc can do that kind of stuff, so it shouldn't be too big of a deal. Cool. Let's see. Just checking on my stream health over here. Looks like everything's still working pretty good. All right. Yeah. Dropped frames, 28%. Still trying to get the right settings on the stream. I was trying to bump up the stream rate to give you a better video quality, but it seems like the higher you crank it up, the more dropped frames you get. All right, Julia. Progesterone on 24th, it was 12.7, not quite 7 days, was done early, would it be worth checking again? So you said not quite 7 days, but I'm not sure, not quite 7 days from what? So generally we check a progesterone level on day 21 of a cycle, and anything over 10 means you ovulated, so hopefully that's answering your question. Let me know what cycle day you tested on, because that'll tell me more than anything. Or maybe you meant cycle day 24, I'm not sure. Flozzy saying, I do not see any discharge on my ovulation day. Yeah, not everybody does. Like I was saying before, the cervical mucus thing is not for everyone. So don't worry if you don't. Annie says, is it normal to experience pain with ovulating? Yes, super common. There is a German term for it called Mittelschmerz, which means middle pain. So yeah, it's common. Let's see, Sarah, are dental procedures during pregnancy safe? Yes, generally speaking, yes, and probably important to do. There is some literature that shows that poor dental hygiene is associated with adverse pregnancy outcomes, preterm birth, low birth weight, things of that nature. They're all small studies and not like horribly convincing data, but there is some data out there. So I generally would encourage someone, if they said, I went to the dentist and they said I've got an abscess or I need to pull this tooth or a root canal or whatever, I would do it. Because I think there is some evidence that if you don't, it may be a higher risk of adverse pregnancy outcomes. So I'd get it taken care of, and it is safe. And, they can use a little sedation if they need to. Particularly if you're like early in pregnancy, it's no big deal. It could be a little bit of an issue if you're late pregnancy. You probably don't want to get too sedated in the late 3rd trimester and kind of maybe not be breathing as good and stuff like that. So, but they can definitely use local anesthesia at any time. Let's see, Jenny, what causes heavy, frequent periods like every 3 weeks or less? Wow, you guys are really good at asking questions that take long answers, which is great because I can just talk forever. The causes of heavy menstrual periods is a long list, but I'll try to summarize it as best I can in a reasonable period of time. One of which is hormonal. Hormonal causes of wacky periods is a thing. And And the simple answer to that is, you know, if at the end of the day you suspect it's a hormonal thing, managing it hormonally is the way to go. So whether that means placing a progesterone IUD, putting somebody on a birth control pill, you know, something like that will very often address the hormonal issues that can lead to abnormal bleeding. There are anatomical reasons that you may have abnormal bleeding. So for example, uterine fibroids, polyps, things of that nature. And those are typically going to be surgically corrected or some sort of procedure to correct them. Now, what's the difference? Well, you know, for fibroids, for example, you know, nowadays you can treat fibroids with non-surgical procedures. So there's this thing called MRI guided focused ultrasound. So that's MRGFUS for those of you keeping up with acronyms. It's sort of experimental, but it's out there and it's getting more traction. So MRGFUS, there's also uterine artery embolization, where it's a radiological procedure that's very commonly done in the U.S. I've referred many patients for that who didn't want to have surgery but wanted to treat their fibroids. Has good data that it will reduce menstrual bleeding. It has good data that it doesn't appear to affect fertility very much. So that's a good non-surgical option. So we got our hormonal stuff, we got our anatomical stuff. There are some essentially like blood reasons. What does that mean? Well, you could have a bleeding disorder. So that's like a hematological reason why you might have crazy periods. So say you have a person who comes in and they've just started having their periods in the last couple of years and they're like murder heavy all the time. They may have a bleeding disorder called von Willebrand's disorder or von Willebrand's disease. And it's a bleeding disorder, and it is very commonly diagnosed when a young woman starts her periods and they're crazy heavy. So that is like the quick version of what causes heavy periods. There's others. There's some endocrinological things. So like if your thyroid's out of whack, that could do it. So that's kind of the quick and dirty version. Hopefully that answered your question. Let me know if there was something specific that I missed. Let's see. Julia is from Australia. Thanks for putting in the comments there. Thanks for the kind words. It's crazy how far away these live streams go. Let's see. Carla, back to the hormonal issues. Previously mentioned to your doc about how he's feeling. Didn't suggest testing thyroid. Instead, he put on clinic to conceive. I think it Clomid to conceive. I mean, you definitely want to check your thyroid. It's one of those things that, you know, if your thyroid's out of whack and you're having a hard time getting pregnant, if you correct your thyroid disorder, very often you get pregnant. So definitely checking that would be good. I'd talk to him about it for sure. Let's see. Kaylee, what are symptoms of pregnancy on birth control, especially with birth control we don't get periods? Right. How the heck do you know if you're pregnant? It's a good question. So look at other symptoms: breast tenderness, nausea, changes in appetite, bloating. Those would be the kind of things that, to me, say I had a Mirena and I wasn't having a period and all of a sudden I started feeling that way, I'd be like, wonder if I'm pregnant. So I would do a pregnancy test. What's the likelihood of that happening? Well, if you're talking about, say, an IUD, it's less than 1 in 1,000, particularly with a hormonal IUD. Maybe it's a little higher with the copper IUD. I've definitely seen more copper IUD pregnancies in my career than I have hormonal IUDs. So like Mirena's. I just saw a Mirena pregnancy the other day. Now, I didn't actually see the Mirena, but I saw her pregnant after her Mirena had been removed. So I think it was a Mirena pregnancy. She said it was. So they're pretty rare. And that's the only one that I know of for a fact. There may have been one other, but I kind of think hers was a copper IUD. I've seen a lot of copper IUD pregnancies. Definitely more of those. Let's see. Lisa says, if you have 10 million sperm and 30% are mobile, is that good enough for IUI? It's not great. You want like 20 million motile sperm. That's kind of your goal for an insemination. So 10 million is kind of low in the first place, and then only a third of them are mobile, means you got about 3 million mobile sperm. Ain't the best. Doesn't mean you can't do it, of course. But if I was counseling somebody with that semen analysis result, I'd say, yeah, I mean, you can do some intrauterine inseminations, but I wouldn't do it for a long time because it's probably not going to work. Doesn't mean that it won't. I mean, I've seen people with horrendous sperm counts that still got pregnant because, as we all know, it only takes one. Now, I say that, but it's not really true. It takes millions because they're like a pack. So they sort of, the way that sperm get to where they need to get to is sort of a group movement. So all those little sperm are swimming together, and it's all their motion together that moves them along. So that's why low counts are a problem potentially. And then also a lot of them die in the process. So if you have a low number that are moving, that's the problem. So you might consider talking to a specialist about that. The most common treatment in that situation is going to be in vitro with what's called ICSI, so intracytoplasmic sperm injection. I'll just, whoa, I didn't mean to do that. Sorry, can't click that button. Intracytoplasmic sperm injection. That is a pretty high-tech fertility treatment, but does the job. Okay. Braley. Jax is 5 months old, thinking about trying for number 2, starting in June. Is that too soon? At that time, 10, 11, it's pretty close. I mean, you know, I think it'd be fine if you got pregnant, number 1, at that point. But if you look at pregnancy outcomes where the deliveries were less than 2 years apart versus more than 2 years apart, so that's that, inter-pregnancy, inter-delivery intervals, what they call that. A little bit higher risk for things like growth restriction, a little bit higher risk for excessive maternal weight gain. Probably comes down to, well, maybe mom didn't lose all the weight the first time around, and now she's pregnant again. Well, why do you care about that? It might increase risk of C-section a little bit. So there's some sort of subtle things that matter. But if someone comes in pregnant and they've got like a 10-month-old, I'm not freaking out, because I mean, heck, you'd be almost 2 years between deliveries at that point. So I think it's fine. You probably won't get pregnant the minute you start trying anyway. So I think that's reasonable. Kaylee says, what are the beginning steps to become a surrogate mother? That's a great question. I mean, I think I don't usually see folks until they've made the decision to be a surrogate and they're working with a fertility group, and the fertility group has said to them, here's the things that your doctor needs to do for you so that you can be ready to do this surrogacy deal. It usually involves making sure you have a normal pap smear. They usually require some kind of like STD screening. They usually require just a general physical exam to say you're in good health. They require a sort of review of your past obstetric history to say this person's a good candidate to have another baby. So those are kind of the beginning steps, and then just kind of getting hooked up with an agency that coordinates all that stuff, of which there are several all around the country. I know several folks working with places in California. There's a group in Chicago I've had a few patients work with. So they're kind of everywhere. I'm sure if you Google it, you'll find a bunch. And there's some pretty good support groups on Facebook. And there's one person that might jump on this Facebook chat. And if she does, we'll ask her what the name of it is, because she knows. Let's see. Erica, 10 months postpartum, breastfeeding, never started birth control, just had your first period. Is this common? Yes. Will my periods most likely get better like they were before I got pregnant? Probably, especially when you completely wean. So, you know, while you're nursing and you're still having sort of the beginnings of periods, there's a battle. There's a battle going on for your body, because nursing wants to suppress your period, and then nature wants you to make more babies. So periods are a little bit wacky when you're coming through that weaning period. So probably things get better as you come along in the weaning process. Let's see. Flozy, does folic acid help to conceive? Nah, probably not. It does reduce your risk of spinal cord defects, so spina bifida and neural tube defects. So it is important. It does not interfere with Clomid, and you should definitely take it. But there's no evidence I'm aware of that folic acid helps you or hurts you in the getting pregnant part. However, there is one vitamin you might want to consider adding, and that's vitamin D. Vitamin D like dog, if you can't hear across the microphone. Vitamin D. So there's a video on my YouTube channel talks about this, that there's a couple studies that showed, number one, that miscarriage rates were lower in moms who had therapeutic doses of vitamin D. So I've kind of started checking those in people who've had recurrent miscarriage. And almost everybody's low, and pretty much everybody should just take a vitamin D supplement and call it good. Probably about 1,500 international units a day would be a good number. But I am starting to check them, because I think that there's people who were like super low and it's not helping them. So getting that level back up to normal is probably a good thing. Yeah, and I answered that question. Will folic acid interfere? No. Okay, I think I'm caught up. All right, let's see. We've been streaming for 55 minutes. Crazy. It goes so fast. Any advice for someone who is having a hard time conceiving after a miscarriage? God forbid someone's walking by on the sidewalk outside. So yeah, I mean, you know, how many miscarriages have you had? How long have you been trying? I mean, those would be the kind of questions that I would think about. Maybe give me a little more detail and I can try to give you some big picture answers. Anybody else into kombucha? This is mine and my wife's latest thing. I've found that I have less heartburn when I drink kombucha. I have bad heartburn normally. Okay, just waiting to see if Annie had one miscarriage back in November. How long you been trying overall is my other question. And then let's see, Kisa. Hello. Thank you very much. If you guys are jumping on Facebook or YouTube and you have questions, stick them in the chat. That's how this works. And then I can answer your questions. Talking to Annie here about one prior miscarriage back in November. Waiting to hear like how long you've been trying. But I'll kind of talk a little bit about it. It's weird today you're reversed. Yeah, I think it's because I'm for Facebook, I'm using my phone now. I realized that Facebook only streams in 720. So I've figured out you can't tell the difference on the video if I stream from my phone versus my high def video camera. So I switched that over to YouTube because on YouTube you can stream in 1080. And on Facebook they restricted to 720. So that's why. So it's on like a selfie cam. Let's see. How long after ovulation should you take a pregnancy test? About 2 weeks. Have been trying since October. Okay, one miscarriage in November. Okay, so if that's you just started in October, you got pregnant in November and you miscarried, heartbreaking as the miscarriage is, that you got pregnant that pretty quick is encouraging. And the other thing is that your chances of getting pregnant and staying pregnant are higher than, say, someone who's just been trying since October and hasn't gotten pregnant. And that just basically has to do with the fact that we've proven that your system works. So sperm got to the tubes, the eggs were fertilized, that fertilized egg implanted in the uterus. It didn't result in a live pregnancy, but it resulted in a pregnancy nonetheless. So it is actually encouraging, and I wouldn't be discouraged at this point. So I would keep trying. I talked about the vitamin D thing, so maybe check that out. And there's a video on that in my my YouTube channel. Let's see, Jenny, thanks for the kind words. I'll be there. I'm there every day, it seems like. So cool. So we'll see if a couple more questions pop up. We'll maybe wrap this up here in about 5 minutes or so. So if you have questions that you've been waiting to put them in now, because I'm gonna wrap this up here in just a few minutes. Let me know too on YouTube how do you think the quality of the picture looks? I'm trying to run like a little different background and lighting. It looks okay to me, but I can't really tell on my computer screen. So let me know if you're watching it from a phone or a computer too, because I think that changes the video quality. Let's see, Haley. Oh, how often do I come on live? About every Friday or Saturday. I had been doing the old, I call it Facebook Friday. So every Friday around 2 o'clock Mountain Time, which I don't know where you're watching from there, Giselle, but so I'm in Utah. It's not every Friday, but it's most Fridays, somewhere in the afternoon. If you put on notifications, if you subscribe to my channel and put on notifications, it'll tell you when I'm going live, and then you won't miss it. But it's generally Fridays, usually in the afternoon, sometimes Saturdays. Depends on if the skiing's good or not. I'm waiting for a powder day. Watching on a phone looks great. Thanks, Annie, for that. Appreciate it. Massachusetts, 7:40 p.m. there. I've been to Massachusetts. Yep, Kelly's right. Most Fridays I stream. I've done some conferences up at Harvard once or twice. It's a cool town, Boston. Let's see. Haley. Blood clotting disorder. Told us to be on Lovenox while pregnant. Wondering if you should be on an anticoagulant when you start trying. PE after baby number 1 right now, I'm just on aspirin daily. No, I would just wait until you get pregnant and then the viability of the pregnancy has been confirmed. That's what I always tell people. And the reason is there's no evidence that that a blood clotting disorder is impairing your ability to get pregnant or stay pregnant. But there is evidence that the pregnancy itself puts your health at risk. So when you get pregnant and they've confirmed that the baby's viable, so it has a heartbeat, then I would start the blood thinners up. Only because, you don't want to have a miscarriage and then you're on a blood thinner and that's kind of a drag because then you have more bleeding. Keely says, looks good on the laptop. Thank you for the info. I appreciate it. It's amazing. Most people watch these on their phone. I can sort of look at some of the analytics and tell that most folks are watching on their phone, but I watch them on my computer, and so I can really tell when someone has tried to make a good-looking setup on a laptop. So I'm with you, Kaylee. Okay, Londi, 23 weeks, sometimes having some Braxton Hicks. Is that normal? Yeah, pretty common, and especially for someone if it's not your first baby. So kind of the more kids you have, the more Braxton Hicks you'll feel. So I always tell people the uterus is like a big muscle, and the more contractions or the more babies you've had, the stronger that muscle is, the more contractions you feel. Let's see. Sorry, Flezio's asking a couple times, what is the symptom of a blocked fallopian tube? None, unfortunately. That's why you got to do an x-ray to find out. That's called a hysterosalpingogram. So that's the thing to check on if you're concerned about your fallopian tubes. It's covered in my video called Evaluation of Infertility, and there's actually some pictures of what HSG looks like, so check that out. Let's see. Giselle, had Nexplanon removed in November. Does that make the process of trying to conceive longer? Shouldn't. It doesn't appear there's any residual long-term contraceptive effect of a Nexplanon. Probably within a month, there's nothing going on there. So, excuse me, it shouldn't delay things at all. The one that can is Depo-Provera. Depo stays in your system for a long time. Lisa says, what age is too old for IVF? Says, am in my advanced age now. How old are you, if you don't mind me asking? Because that's probably a better way to answer your question. Might have to do IVF. It a little bit depends on the IVF center you're working with. And also depends, wow, watching from Ireland. Holy cow, it's crazy. Ireland is pretty far away, but not as far away as Australia. So we're getting some pretty good reach out there. But as far as IVF goes, most fertility people in the U.S. at least will do IVF with your eggs until either some set age, maybe it's 39, maybe it's 38, depends on the doctor, or based on testing. So that AMH test is predictive in people who are using it for IVF. So if you have an AMH that says you're good, then they'd probably still do it. If your AMH is low and you're in that 39, 38 neighborhood, they're probably going to tell you do IVF with donor eggs, because the uterus itself doesn't age. So it's more about the egg quality. All right, let's see. Alyssa says ectopic pregnancy back in 16, bled for 3 days. What are the chances you ovulate monthly? Should have nothing to do with it. So it doesn't have anything to do with ovulation. It has everything to do with either the openness or closedness of the patency of your fallopian tubes. So if you had an ectopic pregnancy, it indicates there might be some blockage in your tubes. Getting that checked out might not be a bad idea. That is hysterosalpingogram, HSG. Lisa says 36 going on 37. Yeah, you should still be good to go for IVF. They probably will probably recommend you do that AMH test. Hey, Shandy, how's it going up there in North Ogden? How's the weather? It's snowy. Well, there's snow on the ground down here in South Ogden, but not snowing, unfortunately. All right, let's see. Carla, last year missed 3 months for your period. Finally got your period. Felt like uterus was twisting. Got a bunch of heavy bleeding. Now you've missed 2 months. Scared. Happening again. Yeah, I mean, it sounds like you're having some, dysfunction in terms of ovulation. So, maybe seeing a doctor and getting that checked out. You probably need some help with ovulation, if I had to guess. Be the most likely answer. But an ultrasound might be helpful as well, just to check out uterus, make sure things look normal there too. All right. Snowy but melting. Yeah, it's kind of snowy but melting here too. Okay. Let's see. I think we're about done. Been at this for an hour. It's crazy. Okay, if anybody has a last question, I'll answer one more question if someone wants to put one up there. And if nothing pops up here in the next minute or two, we'll probably call it good for this live stream. So while we're sort of winding down, thanks to everybody. Flozy, will folic acid interfere with Clomid? No, I've answered that. Let's see. It does not. Currently 18 days late, hoping you were pregnant but not. Put you on medication to start your period. After taking it and nothing, still haven't started. Could you be pregnant? I mean, it's possible. I would definitely do a pregnancy test in the office. Home pregnancy test might not be as accurate as an office-based. Even urine pregnancy tests in the office typically are better than the ones you can do at home. But some people just don't have withdrawal bleed, so you give somebody progesterone, and they just don't bleed. So I would probably just jump on some Clomid if you haven't already. That's probably your answer. Let's see, Lisa, what low is too low for AMH to make it impossible? Good question. 1.2 is the general cutoff, where they say below 1.2 on an AMH, your chances of pregnancy with your own eggs are low. Now, I don't know the numbers, like how low is low, like what's your chances at that point, but it's not impossible, obviously. But 1.2 is kind of thought to be the cutoff. I took one with the doctor, said it was negative, never missed periods before. Yeah, so I mean, I'd probably just think about maybe doing some Clomid if you're trying to get pregnant. But there's some evaluation you need to do first. Check your thyroid, check your prolactin level, look at your medication, see if anything could be inhibiting ovulation. I talk about some of that stuff a little bit in my evaluation of infertility video, so if you're curious, you can check it out. Okay, we'll give it one more question. Next question is the last question, Facebook or YouTube, whoever jumps on first, and then we're going to call it good for today. So thanks to everybody who's been watching. Thanks for your questions. Thanks for your comments. Thanks for your kind words. Thanks for always the people who tune in every time. Thank you. Thank you if it's your first time, if it's your 50th time. I really enjoy doing these. It is fun. And I've met a lot of people, actually, who have who've reached out to me in real life. Okay, cool. Thanks to everybody. I'm not seeing any questions popping on, so I think we'll just kind of wrap it up right there. Thanks again to everybody. There's a couple of people jumping on Facebook, so maybe I'll give you a minute. If you're on, there's the dog. If you're on Facebook and you got a question, last chance. Here we go. That's a corgi, if you're wondering. He barks a lot. Okay, well, I'm not seeing any questions, so thanks, everybody. We'll wrap it up right there. Catch you hopefully next Friday. See ya.